Are there new treatments for genetic lipid disorders? Are there new treatments for genetic lipid disorders? This is a question many people are asking, especially those affected by conditions related to cholesterol and lipoprotein. Genetic lipid disorders can lead to high levels of low-density lipoprotein cholesterol, often referred to as bad cholesterol, and elevated lipoprotein, which can increase the risk of heart disease and stroke. Traditional treatments like statins are effective for lowering low-density lipoprotein cholesterol but do not significantly impact lipoprotein levels. Fortunately, there are exciting new treatments on the horizon. One of the most promising is lepidosiran, an investigational therapy that uses small interfering ribonucleic acid technology. This treatment targets the gene responsible for producing lipoprotein and has shown the ability to reduce its levels by up to 94%. Clinical trials indicate that the effects can last for at least a year, making it a potential game changer for patients with high lipoprotein. Another emerging therapy is pelacarsen, an antisense ribonucleic acid therapy that is currently in late-stage clinical trials. It is designed specifically for patients with high lipoprotein levels and a family history of cardiovascular disease. This treatment is expected to receive approval from the Food and Drug Administration soon, which could provide new options for those affected. In addition to lipoprotein lowering therapies, there are advancements targeting the ANGPTL3 gene. This gene produces a protein that inhibits enzymes involved in lipid metabolism, leading to increased low-density lipoprotein cholesterol and triglycerides. Evkeeza, a monoclonal antibody that blocks ANGPTL3, has already been approved for rare genetic conditions like homozygous familial hypercholesterolemia. This drug has shown significant reductions in low-density lipoprotein cholesterol levels. Gene editing technologies are also making strides. Therapies using CRISPR, a powerful gene editing tool, are entering clinical trials. These therapies aim to target genes like ANGPTL3 and LPA, which is the gene for lipoprotein Early studies in animals have demonstrated substantial reductions in lipid levels with just a single treatment, and ongoing trials are assessing their safety and effectiveness in humans. Moreover, there are new oral alternatives to existing treatments. PCSK9 inhibitors have become more accessible and are a key option for patients who cannot tolerate statins. New oral forms of these inhibitors are being developed to improve convenience compared to injectable options. These advancements provide hope for individuals with genetic lipid disorders who have struggled to manage their conditions with traditional therapies. The focus on lipoprotein and ANGPTL3 represents a shift toward more personalized medicine that targets specific genetic causes of high cholesterol. Patients with a family history of early heart disease or elevated lipoprotein levels may find these emerging treatments beneficial once they become available. In summary, the treatment landscape for genetic lipid disorders is evolving rapidly. With new therapies targeting previously untreatable conditions, there is a brighter future for managing cardiovascular risk associated with high cholesterol.